Well, here it is, early 2019, and already candidates are lining up for the next presidential election, over a year and a half away. While it's way too early to know who the final candidates are going to be, we do know this. One of the main arguments, one of the main campaign promises that are going to be made on the campaign trail is Medicare for all. The Democrats are lining up behind this issue to the point where a new bill will be introduced to the House sometime in the next few days on a Medicare for all plan. Now, the Democrats know that this bill has no hope of getting through the Senate or ever being signed by the president. But what they're doing is starting to build the tables, build the argument for Medicare for all, and this is going to be one of the fundamental issues for the next campaign. So let's take a look at this new bill and what we know about it, or what's at least being reported about it, and what it would look like. This is the first in a series of videos that will break this bill down and start to discuss what does it mean, both positively and negatively. Let's start with what's in the bill. First of all, the bill that's going to be introduced in the House includes language that says everyone's in, to the point where it's reported that language is going to talk about residents of the United States, not citizens, which means they're contemplating having Medicare coverage for all, including those undocumented aliens, illegal aliens, whatever you want to call them. Those people who are not currently citizens of the United States would still have coverage. It's important to understand because it expands the scope a great deal. It also has language in it for full and comprehensive medical care. Vision, dental, preventative care, etc., all included in this one bill. It has provisions in it for long-term care, another add to the bill, if you will. It also has comments in there about no financial barrier to care. What this means is free health care. No copays, no deductibles, no coinsurance, no cost sharing whatsoever. Basically, if this bill passes in its form that it'll be introduced, everyone will have a card with an unlimited bank account tied to it, and you'll get whatever care you need for free. There's language in the bill that talks about a single standard of care for all. What this is directed at is making sure that it's illegal for practitioners to create a fee-for-service system, quote unquote, for the rich. So unlike some other countries where there's nationalized healthcare, but if you want to pay for it, you can go to a different doctor or get different access, this bill would make that illegal. Everybody gets the same. No more free or no more advanced care or better access for the rich. The bill talks about national and regional global budgets for hospitals. Now, there isn't a whole lot of detail on how those would be set or at what level. But it contemplates this idea that there would be a fixed amount of payment, a fixed amount of money for hospitals and potentially doctors, although it talks about doctors being potentially under a fee-for-service environment. It just doesn't specify at what level, and that's important. The thing to understand about fixed budgets is, well, what happens when more care is needed than what's in the budget? What happens when more people show up in the ER than what the hospital got paid to see? It's an interesting question. There's language in the bill protecting workers. Understand that healthcare is one of the largest employment segments in this country. So if we go Medicare for all and get rid of insurance companies, what happens to all those employees? If we go with a fixed budget on a hospital basis and the hospital says, well, I can't make it under the current staffing level, I have to fire some nurses. What happens to those nurses? What this bill basically says is they won't be allowed to do that. They specifically even talk about no union busting. So in other words, these hospitals are going to be under some sort of fixed budget, but they won't be able to reduce their expenses by reducing employees. The bill talks about a 2-year transition period from where we are today to a point where there's Medicare for all and there aren't any insurance companies. It allows for for-profit facilities. These are hospitals owned by for-profit Wall Street companies. But it does say it's going to limit their profits. Now, this is also another interesting scenario. Basically, it's like saying, well, you can go to Vegas and you can bet on the craps table and you can lose money. But if you win, we're going to limit how much you can win. I wonder how many companies are truly going to be interested in owning for-profit hospitals when their ability to make profit is significantly limited. Now, it deals with the issue of drug prices and drug cost by basically saying that the government, now the only purchaser, is going to negotiate much better rates with Big Pharma. And it gives them an incredible stick that they could wield. Because in the bill it would allow the government to pull a patent on a drug if it feels like the drug company isn't negotiating in good faith. Think about that for a minute. A drug company spends an awful lot of money on research and development. They finally get a drug to market. The government says, we think we should pay X. The drug company says, we've got way too much money in the development of that drug. We need X plus 10%. And the government says, you know what? I don't think so. I'm going to pull your patent. Now anybody can come in behind them, create the same drug in a generic formula. All bets are off. That's a really interesting scenario. And it begs the question, are the drug companies going to want to put that much into research and development? Now, I'm not defending Big Pharma here. I'm not saying that they aren't without their own warts, if you will. What I am saying is this is a significant departure from what we're used to in a market-based free economy. Finally, it allows for continued funding for Indian Health Services in the VA system. I'm not sure how that really fits in Medicare for All. Assuming that, let's say, veterans and folks that are Native Americans would have that same Medicare card that I do and that you would they really go through the VA system? I haven't heard too many people clamoring for the great quality and service that happens at the VA system. But the bill does contemplate them still having funding. So that's it. That's what's in the bill. The bill basically takes the largest segment of the U.S. economy and turns it upside down, turns it on its head. It changes how we fundamentally have been providing, financing, and consuming healthcare in a matter of 2 years. Pretty dramatic change. So the next several segments of these videos are going to talk about how these changes impact things like the economy, how they will impact providers of care, how they will impact consumers of care, and then finally, what conclusions can we draw from this, and what's likely to happen if this thing actually gets passed. I'll leave you with this. The one thing that concerns me most about this is not that we don't need to change healthcare. We absolutely need to change healthcare. It's clearly broken. I'm worried that this may become the Democratic Party's wall. What I mean by that is, if they get too many people behind it making too many campaign promises, they could find themselves in office having to deliver on those promises. We're experiencing that right now with the current administration that made a promise about a wall and has now got to deliver on it. What happens if that healthcare, if Medicare for All becomes the next wall issue? I'll leave you with that, and then we'll move on to the next segment next. Thank you.